Today, we're continuing our series on poverty and inequality in the United States with a discussion of paid leave, how it's structured, how it amplifies inequality, and what Congress might do about it. With us are Wendy Chun Hoon, Executive Director of Family Values at Work, which advocates for paid leave policies, and Indi Duda Gupta of the Georgetown Center on Poverty and Inequality. He's also an adjunct professor at Georgetown Law. We'll hear from both speakers, then we'll have some questions. I'll have some questions, then we'll have plenty of time for Q&A. If you have a question, raise your Zoom hand, the little green button on the bottom of your screen, and we'll give the microphone to you. You can also put a question into the Q&A text function. And please tweet today at #NPFPoverty. So Wendy and Indi, I want to thank you very much for taking the time to come talk with us and with our journalists and other viewers out there. We're going to first turn to Wendy, who is going to talk about where we are at this pivotal moment on paid leave issues. And she is going to present, and then I may have some questions for her, and then we will move on to Indi, and then we'll get to a round of questions from all the viewers out there. So if you want to get a question into the queue, raise your hand or put it into the Q&A text at the bottom. So Wendy, welcome, and I'll turn it over to you right now.
Thank you. I'm glad to be here with you all today. And thanks, Chris, to you and your team for getting this set up. And then to everybody joining for all your interest in these critical issues. So I will primarily focus on three things. One, I just want to start by reflecting on the moment we're in and the salience of paid leave, and also a broader care infrastructure for not just COVID response, but for economic recovery, including families' economic stabilization, and also broadly for racial justice. I want to talk a little bit next about what we've done in the States to really build what we call the three M's, the movement, the models, and the momentum for paid leave over the years to really prime the issue for Capitol Hill, and also for an inclusive and permanent federal solution that we need. And then I'll sort of leave off and turn to Indi, saying a little bit about what Congress has done and also what Congress still needs to do. So Tyler, if you can go to the next slide, please. I mean, this is just really the obvious for all of us that, the past 9 months has really brought to the forefront what many of us have known for decades, that our country is in a serious caregiving crisis. And I think in our experience at Family Values at Work, most people don't actually think about paid leave until they need it. And then they realize that they don't have any. And so this pandemic has really amounted to our country having that realization all at the same time. And, while our economic competitors, in fact, nearly every other country in the world, have seen the importance of people being able to care for themselves and their families, we have failed to do so. At my organization, Family Values at Work, we really see these conditions as rooted in our country's historic dependence on women, and specifically women of color and immigrants, to provide both caregiving inside of the home and also outside the home for free and very suppressed compensation. And it's these conditions that have always had consequences for gender and racial equity, for families, for economic growth. And, this pandemic has highlighted huge consequences also to the public health because of our country's lack of paid leave. So I'd be remiss, and then Tyler, you can go to the next slide, if I didn't and try to bring some good news. So I'll say that Family Values at Work, along with a growing set of partners, have really demonstrated that paid family and medical leave and paid sick and safe days are the proven and very popular policy solutions that start to get to the heart of this problem. So what you're looking at here on this slide are the timelines of wins that we have won. The top timeline is paid sick and safe days. I'm going to come back and distinguish in a second what I mean by that. And the bottom timeline is paid family and medical leave. And, in total, you're looking at 60 new laws won over the past, better than 15 years, and really new protections for more than 55 million workers and their loved ones. So let me take, 30 seconds or so and distinguish between paid sick and safe days and family and medical leave insurance, or also called paid family medical leave. So paid sick and safe days, we're really talking about a handful of paid job protected days each year for things like routine illness, preventive care, really importantly. And the reference that I make to safe days is to make sure that people understand that in many of these laws, you are allowed to use earned paid sick time to seek support, follow-up services in cases of domestic violence, sexual assault, etc. The situation in our country is that more than 1 in 4 private sector workers aren't even allowed to earn a single paid sick day. And I'm just gonna, one more thing I'll throw at you. The closest bill that's sitting in Congress right now that is modeled after these city and state wins is called the Healthy Families Act. We can come back to that later. The bottom timeline there is talking about paid family medical leave. So when I say that, I'm talking about longer leaves. We're talking about several weeks of time away from work, paid time away from work, for cases like welcoming a new child into your home, addressing your own serious illness, taking care of a seriously ill loved one. The situation in our country is that only 19% of private sector workers have paid family leave through their employers. About 40% have paid medical leave through their employers. So clearly not enough. And I'll just mention now that the closest bill in Congress that's modeled after these state programs that you see on the screen is called the Family Act, and we can come back to that later. And I just, before we leave this slide, want to say what's helpful, I think, is you all as reporters, as you write about this, is to try to distinguish between paid sick and safe days and paid family medical leave. They're really two different types of leave that often get bucketed as paid leave. And to note, I just want to note now that the longer leave, paid family medical leave, really needs to be for all 3 of the purposes I mentioned: the welcoming a new child, but also importantly, your own serious illness or family care for a seriously ill loved one. That fullness of the program is not the same as, and shouldn't be equated with, just time off for a new child coming into your home. So we can come back to that too. Tyler, if you could go to the next slide. So what have we learned through all of this work is really that there are some key things that serve as the essentials to get to equity in these policies. And equity is absolutely essential for these policies to be effective. So we made this nice graphic that we call the AAA graphic, but essentially it boils down to these things. And I'm going to focus now mostly talking about paid family medical leave. And it really comes down to 4 things: to make sure that these policies are designed in an inclusive way, or to be inclusive, that they cover all caregiving, that they're accessible to all workers. Second thing, they have to have high enough wage replacement so that they're affordable. The next A. So the wage replacement has to be enough that you can afford to take it. These policies have to protect your job so that you are not in jeopardy of losing your job when you need to take time away under these conditions and step back from the workforce for a couple of weeks. And finally, that they're, a sufficient number of weeks. So I just, will point out here what's helpful, I think, as you write about these issues, is to be really clear-eyed about not equating some of these things with all of them. We really see this, and call it AAA for a reason, that the programs have to be, and the policy have to be designed in this way, or else, it's not just that they're not incremental, it's actually a step in the wrong direction. They cannot be effective as a program unless they cover the full AAA sort of landscape here. Tyler, I want to go back one slide, back to the timelines if we can, and just kind of play this out a little bit, the history of this work. So I'm going to focus on the bottom timeline and just talk through, California, you can see, won the country's first paid leave program in 2002. You can see the gap in the timeline. It took 6 years to then get to the next win in New Jersey. It took 5 more years to get to Rhode Island's program. It took 3 more to get to New York. And then look at the timeline speed up. In the last couple of years, we have more than tripled the number of those first wins. And so again, what we've learned from the early states on the timeline has really led to the coalitions, in the later part of the timeline in the states to continue to improve on that model by doing those AAA things, adding job protection, progressive wage replacement, a more realistic number of weeks, more inclusive definitions of family. So, so just a kind of quick recap of what we've learned over the time. We learned from California and New Jersey that when the leave is paid, more fathers are taking it. That absolutely increases gender equity in the home and in the workplace. That women who take paid leave have increased labor force attachment. Really importantly, we've learned from research from the early programs that have shown that the lack of job protection, or when the wage replacement is too low, so something at the margins of, half of your wages replaced, and if you're a minimum wage worker, you know how little that is, that lack of job protection, low wage replacement actually prevent low paid workers and workers in lower quality jobs from being able to take full advantage of the programs. So what do? We take the lessons from these early programs and we hardwire them into laws like Rhode Island, who was the first state to actually win job protection. And now, when you look at the end of the timeline there, most programs have job protection. All discussions start with the absolute need for job protection. California this year finally won increased job protection for 6 million more workers covered by job protection. I'm picking out a few here: New York, Washington, Massachusetts, right in that middle bunch. They all pushed for more time, more weeks. They secured at least 12 weeks. And now most of the programs, most of the newer laws won, have at least 12 weeks of leave. Again, Washington, D.C., Washington State, Massachusetts pushed for and won higher, more progressive wage replacement, up to 80-90% of wages replaced for the lowest paid workers. California and New Jersey went back and reformed their programs based on that. And all of the newer programs have at this point done the same. And then really establishing a more realistic definition of family. The early programs were based on the FMLA, the one federal permanent policy, FMLA, that provides unpaid leave to some of the unpaid but job protected leave to some of the workforce, not all of the workforce. And that definition of family was really just married spouse, blood-related parent, blood-related child. So pretty limited and not who our families are in their fullest. So states have therefore really pushed through, updated the concepts or the definitions of family, and 4 now have what we consider the gold standard definition that's very inclusive. Okay, so Chris, Tyler, sorry, go back now to the AAA slide, and I'll just wrap this by saying, the policy really has evolved significantly based on what we've learned didn't work in the early programs for workers that were paid low wages or in lower quality jobs. And we've now adjusted the baseline for newer states according to what these evidence-based ways to hardwire equity and effectiveness into the policy. So leaving you with the AAA. And we can go to the next slide, Tyler. So more good news, through this work, we have mobilized a large movement that has organized for many years now to win paid family medical leave and paid sick and safe days in the states across the country, and really building that momentum for federal policy. So, when COVID hit, these policy models and the proof that they work were already teed up for Congress. One of the earliest package, if not the earliest, the Families First Coronavirus Response Act, FFCRA, really adopted some of this and became the first national policy on emergency paid sick days and emergency leave, temporary. And I'm personally really proud that our movement helped to win those things, and especially in this moment. And I think the evidence base has gotten even clearer. Some research done that I think Chris will send in the follow-up materials, a couple of links, showing that during this pandemic, the places that had paid sick days actually helped to stop the spread of COVID were better equipped than other states and locales. So, really important what was won, but of course, it wasn't perfect. And thanks to, lobbying from the chamber and others, the bill actually left out, these emergency paid leave provisions actually left out up to 106 million workers. So who are those workers that were left out? Up on the screen, they're folks that work in companies of more than 500, so really big corporations. They're workers that work in really, much smaller companies under 50 that aren't guaranteed these emergency paid leave provisions. Most healthcare and emergency responders, ironically, carved out. And then importantly, the longer leave, the emergency paid leave exists, but it really is only to care for kids who have been affected by school closures or childcare closures. It doesn't actually cover you for your own, let's say, COVID illness or family caregiving for somebody in your family or a loved one who's been impacted by COVID. So Congress did something, but it was far from what is actually needed. And I just want to share with you folks that we organize with across the country. Chris Garcia, who's on the left, in both of his jobs, one is for a big airline company, one is for a big packaging delivery company, carved out of the FFCRA provisions. Chris has a health condition and, is around coworkers all the time who are being forced to work with COVID. Maggie, the young woman on the right, is the daughter of a farm worker, and her mom left out of COVID. And these are, thousands of farm workers who are growing and handling our food in this really important time, again, left out. So I'll now wrap, if you can go to the next slide, Tyler. So for the roughly 60 million workers who did qualify, one really important thing at this moment, benefits are sunsetting at the end of this month. And we know that COVID is going to be with us a lot longer. We also know that it's not like cancer or heart attacks or car accidents or births have gone on hold during this pandemic. And of course, those things are going to be part of our lives after there's a vaccine. So, not having the kind of care infrastructure is really sending a lot of families into, economic tailspin at a time when resources are already sparse. So again, we're, coming out of an election still deep in the pandemic. We know that we have an urgent need for a care agenda. We clearly have a mandate for it and proof from all of these places that it makes a difference. And so what I want to do final thing I'll say is ending with that tail end of the wins timeline, if you saw it, is Colorado. So state of Colorado, in the midst of COVID this year, passed both a paid sick and safe days law through the legislature, and just in November, a paid family medical leave program by the ballot. These are Colorado's policies are among the strongest, if not the strongest policies in the country to date. And it is no surprise to any of us who work closely on this that on November 3rd, the voters in Colorado voted for paid leave on the ballot at higher rates than they voted even for the Democratic ticket. And paid leave won in districts where actually Trump took the majority. So really clear from this Colorado example, but also I included a couple of links to recent polling that shows that running on the care economy issues was absolutely critical to the Biden-Harris ticket, and also that voters are absolutely unified in their strong support for a care infrastructure. Our network and many others right now are this week, next week, till the end of the month, till it gets done, fighting to expand and extend the emergency provisions through the end of this pandemic, and then to ensure that we are going to transition them into permanent and fully inclusive programs based on everything that we've learned in the States. So I will leave it there, Chris, hand it back to you or to Indy.